Ladies and gentlemen, hello and welcome to my channel once again. In this video, I have identified 15 questions based on Chapter 1 of NABH 5th edition. These are questions you can ask your patients and visitors. Chapter 1 is Access, Assessment and Continuity of Care. There are 14 standards and 91 objective elements in this chapter. Your own internal audits may not always help you to identify drawbacks in your hospital's processes, so it is advisable that you take the opinions of your patients and visitors to identify the weaknesses in your processes. This way you will be able to take necessary corrective and preventive actions to address those issues. Visitors also include the relatives and attendants of the patients. It is preferable to ask random questions as you proceed with your daily routine work. Ask only the most relevant and important questions. Within brackets, I have mentioned the sections to which the questions are relevant as a guidance. Apart from these questions, you can also prepare your own questions based on your process requirements. Question 1. Have you been informed about the services provided by the hospital? This is from intent of the chapter. Why you should ask this question? As per NABH, it is mandatory to inform the patients and family members about the services offered by the hospital. Question 2. Has the treating doctor explained the discharge process to you? This is from intent of the chapter. Why you should ask this question? It is mandatory to explain the discharge protocol to the patients and family members. Question 3. Has the treating doctor explained the transfer process to you? This is from intent of the chapter and also from AAC 3B. You can ask this question to a patient who is being transferred to another hospital. Why you should ask this question? As per NABH, it is mandatory to inform the patients and family members about the transfer process and the formalities. Question 4. What is your opinion about the display of the healthcare services? Were you able to locate the display easily? This is from AAC 1D. Why you should ask this question? As per NABH, it is mandatory to display the hospital's healthcare services prominently so that the display is visible to all the patients and visitors. Question 5. Are you aware of the registration process? This is from AAC 2A. This question is for the OPD patients. Why you should ask this question? It is mandatory to inform the different steps in the registration process to the patients and their family members. Question 6. Are you aware of the registration and admission processes? This is from AAC 2A. This question is for the IPD patients, that means, patients getting admitted. Why you should ask this question? It is mandatory to inform the different steps in the registration and admission processes to the patients and their family members. Note: the objective element says that this information can be given through displays and also on hospital's website. But this information should also be given by the front desk staff during registration and admission. Question 7. During admission, did the front desk staff explain the rates of different bed categories to you? This is from AAC 2D. You should not only hand over the rate chart to the patients and their family members, but you should also explain the same to them. Why you should ask this question? If the desired category of bed is not available and the patient or family members are forced to select a different category of bed, then it is mandatory to explain the financial implications of such different category bed. Question 8. Is the treating doctor coming to visit you and check your condition? This is from AAC 5A. I have put this question here because, often the patients or their relatives complain that the doctor is very infrequent in visiting and reassuring the patients. Why you should ask this question? For the doctor, it is mandatory to reassess patients in every section, including daycare patients and patients waiting for admission or for bed allotment. Question 9. Was the next follow-up date informed to you? This is from AAC 5B. Why you should ask this question? It is a normal practice to give the next follow-up date to the OPD patient. But sometimes, the doctor may forget to inform the next follow-up date to the patient. Just noting it down in the patient's file is not sufficient. Question 10. How long did you have to wait before being taken in for the test? This is from AAC 9F. This question is with reference to radiology services and is common for OPD, IPD and emergency patients. Why you should ask this question? NABH demands that the waiting time should be monitored. You can do this through feedback forms. You should preferably create separate forms for OPD and IPD. Question 11a. For how long did you have to wait before being taken in? This is from AAC 12G. This question is common for laboratory, radiology and OPD. Why you should ask this question? The hospital should have defined timelines for keeping the patients waiting. This timeline should be informed to the patients. Question 11b. Were you informed about the waiting time and was the reason for delay explained to you? This is from AAC 12G. You can ask this question if the patient tells you that she was kept waiting for a longer period of time. Why you should ask this question? NABH demands that in case there is change in schedule or in case the patient is kept waiting for a longer period of time, then the same should be informed and explained to the patient. Question 12. Was your discharge planned in consultation with you? This is from AAC 13A. Why you should ask this question? It is strict NABH requirement that the treating doctor should plan the discharge in consultation with the patient and the family members. Question 13. Has your treating doctor explained to you the possible complications and risks involved in leaving against medical advice? This is from AAC 13C. Why you should ask this question? You should specifically ask this question to LAMA patients. Because explaining the consequences of LAMA is a mandatory NABH requirement. Question 14. Has your treating doctor explained to you about continued care and medications that you are supposed to take at home after discharge? This is from AAC 13E and AAC 14E. This question may be asked to a patient whose discharge process has started and the patient is waiting for the final discharge papers and the discharge summary. Why you should ask this question? Point number 1. Patient has to be mandatorily educated about continued care. Point number 2. The follow-up advice, preventive aspects of care, medications and other instructions should not only be documented in the discharge summary, but should also be explained to the patient and family members. Question 15. Have you been explained about the circumstances under which you should seek urgent medical care and whom you should contact in case of an emergency? This is from AAC 14F. This question may be asked to a patient whose discharge process has started and the patient is waiting for the final discharge papers and the discharge summary. Why you should ask this question? This is an important requirement of NABH, whereby the discharge summary should give clear instructions on when and how to seek urgent medical care. This should also be explained verbally to the patient and family members. You are free to modify the questions to suit your own requirements. These questions are just examples of how and what questions can be asked. This question-answer exercise is a very good method for understanding the gaps in your processes and taking adequate steps to remove those gaps. If you have liked the information that I have shared with you, then please like my video and subscribe to my channel. Once again, thank you very much for watching till the end. Have a great day.